So we are here today back in our studio, which is slowly coming together. We've built this specifically for this podcast, and so having a lot of fun here at Arkansas PBS, and we're here with Dr. Teresa Hudson from the Psychiatric Research Institute at UAMS. And so thank you so much for joining us.
My pleasure.
Yeah. And so, I mean, my first big question, because like I said, we're doing a lot of research about mental health and how it affects the ag industry. And so, yeah, we stumbled upon the PRI Institute there in Little Rock. And so what are y'all up to? What do y'all do there?
Okay, so the Psychiatric Research Institute is really devoted to mental health. And we have a three-part mission, clinical care, education, and research. And I'm largely involved with the research piece, although the center I run has some has clinicians in it as well as researchers.
Awesome. And so what kind of research are you doing right now? What are y'all digging into?
PRI has several research centers located in it. The one I direct is the Center for Health Services Research, and this center really focuses on a variety of strategies to improve mental health, often at the population level rather than just one-on-one. Okay. But we also we have about a dozen researchers working on suicide prevention, on identification and treatment of alcohol use disorder, of opioid reduction and opioid safety, and increasingly we're interested in mental health in farm workers and agricultural workers.
Awesome. Yeah, so I mean, that kind of brings us right back to our grant that we've received from the USDA and then being facilitated through the Arkansas Department of Agriculture. And so, so we're 100% kind of addressing this growing issue among farm workers and ag workers of this growing mental health crisis. We've seen a spike in depression and anxiety and burnout and even suicide rates. So, I mean, have y'all, a lot of my research that I find on the internet, a lot of my stats, it's kind of a national or even a global number. Have y'all gotten a good idea of this just here in Arkansas?
Unfortunately, I have not found good numbers in Arkansas.
Right.
And so one of the things we're considering is whether we need to do some work getting just baseline numbers. But on the other hand, as you allude to in some of the questions you were thinking of asking, it is not easy to get the agricultural community to talk about mental health. So it's not easy to get those particular stats.
Right. Absolutely. No, I mean, we're doing our podcast, which, as you know, we're following 6 farmers, and then we're also doing some short documentaries with some independent filmmakers outside of the building, and we're even doing a broadcast piece. We're doing a lot of work with the Department of Ag, and yeah, just finding the stories, just finding the farmers who are kind of willing to open up their lives and talk about this issue. That's been a real trick, just laying the groundwork for the project. And so I can definitely understand that maybe y'all are kind of feeling around in the dark just like we are, trying to kind of get this population to talk about this stuff. So I know a lot of your research, I kind of did some checking in on you before we started, and a lot of your research kind of comes back to medication for mental health and treatment for mental health. And, I grew up in a farming community, and my grandparents were farmers, and I had a grandfather who drove a truck for years, and he had back trouble my entire life and in his older age, and probably needed back surgery, but would never go to the doctor to get it checked out, right? Because he was of that generation that a back surgery was like a death sentence, right? I mean, he couldn't imagine. And I think a lot of older generations, older farmers, rural people look at mental health that way. They're slow to want to take medicine. So, I mean, what have you seen here in Arkansas kind of in that realm?
So a lot of people are hesitant to take medication, and I'm okay with that. I was originally trained as a pharmacist, and people say, gee, why aren't you pushing medication more? Well, it can be very, very helpful, but not everyone likes it. And for that reason, there are other kinds of treatments that are very helpful, including psychotherapy or counseling. That's very helpful and very effective, actually. And medication plus psychotherapy or counseling is extremely effective. Okay. So it's a great combination. And you don't necessarily start medication to be on it for a lifetime. Mm-hmm. It isn't a given that just because you start, say, an antidepressant, you have to take it for the rest of your life. Just like if you start a medication for treatment of high blood pressure, you may not take that for the rest of your life. You may be able to do some other things to manage your blood pressure. So it's kind of the same thing.
Yeah, I think, one of my other questions, I think a lot of farmers, they're used to treating animals, and they're used to treating, they're very willing to go to the doctor to maybe treat a physical ailment, right? Mm-hmm. If I smash my hand in a combine or something, I've got to go to the hospital. That's without question. But then we kind of bring up this idea of mental health, and there's a hesitance there. It's interesting, people don't consider mental health as urgent as physical health. So, do you have a response kind of to that mentality?
Well, increasingly, we're very aware of the relationship between mental and physical health. So individuals with untreated depression and anxiety also have higher risk for cardiovascular disease, so high blood pressure, heart attacks, stroke. They are at a higher risk there. They are at higher risk for injuries. Interesting. That was not one I expected because I was doing a little homework. And so it comes down to having an effect on your physical life. The other thing that is interesting to me is if you're depressed and really have a lot of anxiety, or you're really just super stressed, because this is a pretty stressful time in our lives. How do you know you're making good decisions? Right? Mm-hmm. How do you know you're making good financial decisions, good decisions about your children or your spouse or your business? Mm-hmm. How do you know? And often they're less people who have untreated anxiety and depression are not necessarily making good decisions, and it can have economic impact on them.
Absolutely. Yeah, I think one of the kind of quick knee-jerk decisions that we hear a lot, and I've heard it particularly from one of our farmers, but several of them, we're 2 months in, and so I've heard 12 stories now at this point. And a couple of them, they'll gladly tell you what's going wrong, what they're struggling with right now on their farm. But then I think kind of an idea in that population is they just kind of shrug and say, but I just got to roll with the punches. I've just got to deal with it. So is that, I assume that's probably a pretty common phrase that you hear.
Indeed. The one I always say is farmers are very inclined to say, well, you kind of pull yourself up with your own bootstraps. Mm-hmm. And I get that. My grandfather was a farmer. I get that. On the other hand, if you're willing to go have your back checked for pain, maybe a little check for some mental stress and pain would be worthwhile. Mm-hmm. And one of the things I've tried to get away from is always labeling things as depression or anxiety, or because really, in reality, what we have right now is a lot of stress in our lives. And for some reason, I don't know why, people are comfortable saying, oh, COVID is driving me crazy. But they're not comfortable saying, it's making me anxious, or I'm feeling really sad, or I'm feeling really depressed. Mm-hmm. And so I hope that that we can urge people to go ahead and describe their concerns, whatever's comfortable for them, but go ahead and seek care for it.
Yeah, this idea, and you bring up COVID, and so that kind of leads me into what I wanted to talk about today, and kind of these different kinds of stress. Because we talk to farmers, and I've talked to farmers my whole life growing up, and so a lot of it is day-to-day stress of, the soil's too wet to plant, or I've got a flat tire on my tractor. And so that's kind of like an acute specific stress. But then specifically, especially in these interviews we're doing right now, we've had farmers dealing with COVID for the last 2 years. Mm-hmm. And man, it felt like a couple of months ago we could see the light at the end of the tunnel. Felt like it was easing up. And then we have this conflict in Ukraine, and now that's all of our petroleum-based products. All of our fertilizers have shot through the roof. Well, that's a much bigger kind of stress now. Mm-hmm. And so how do these different kinds of stress, we kind of got that daily small stuff, and then we kind of have this large, looming, lingering, how do those affect us?
So if you're stressed constantly over a long period of time, it really decreases your ability to manage those daily things that are, I woke up this morning, I had a big plan for planting whatever, and now I can't do today's plan. And so, that's going to put me behind. But if you are overall managing stress well, you're better able to deal with those daily stresses.
So we know that farming is emotionally and mentally taxing. That's exactly what we're doing here, right? Mm-hmm. Is I think that's kind of the thing we want to highlight. And so I think the general public, a lot of people don't get into farming because they don't want to stress their back. They don't want to bale hay in the middle of August. And so we're kind of trying to say there's a whole other level of stuff going on. And so that kind of this mixture of physical and mental labor.
Absolutely.
Long term, what can that do to it? If you're baling hay once a year for 50 years,
So one of the things that interests me is the interaction between stress and things like depression and anxiety and pain. Mm-hmm. There's quite a lot of interaction. People who are experiencing a lot of stress will also tend to complain more of pain. And sometimes it's back, sometimes it's abdominal pain, but back is usually the most common, but abdominal pain is common also. And so if you can find a way to manage that stress, you will physically feel better and be in a better situation to do your daily work, as well as I talked about before, making decisions and so on.
Mm-hmm. And, a lot of folks in the South, even myself, I suffer from diabetes. There are a lot of diseases and things that aren't necessarily pain directly, right? How does stress affect kind of the management of some of these background disorders?
It can make it much harder to manage them. Diabetes is a perfect case, right? If you're stressed, your body's supposed to maybe put out a little more insulin to help you deal with, gather more energy to deal with the stress, right? Mm-hmm. And so if you're diabetic, it's harder to deal with that stress. If you have other ways to manage that and calm that down, you'll feel better physically.
Right. So let's say I'm a farmer, or I'm a family member of a farmer, I'm a community member of a farmer, and I've never considered that I might be depressed. I've never considered that I might need to seek counseling or even medication. What kinds of symptoms should I be looking for? When should we maybe have a conversation about this?
So the first thing I always tell people is, if it's coming to your mind that I don't know if I can do this, I'm so tired I can't get up and do this anymore, or I can't sleep at all, you probably should talk to somebody about what could be done. And in Arkansas, I was remiss in not mentioning this earlier, we have the program at UAMS called AR ConnectNow.
Okay.
And AR ConnectNow is a virtual urgent mental health clinic. So the way it works is there's a 1-800 number, and I'll direct you to it, a 1-800 number for the statewide, and then if you happen to be in Central Arkansas, a local number. You call that, a nurse answers, make sure you're not so acute that we can't help you. And then we'll offer you the opportunity to make an appointment. And usually that first appointment is within 1 working day. And the person is seen by usually a master's trained counselor. And that first visit is really devoted to working with you to figure out what you need. Mm-hmm. And then from there, we make an appointment. Usually the second appointment takes about 3 working days. Okay. And we make another appointment to begin counseling, if it seems that you might need medication, we have a psychiatrist available to help with that. And that is free. If you have insurance, we're grant funded. So we're required to bill the insurance, but the grant pays the copay. And if you don't have insurance, that's fine, but we'll offer to help you get insurance if you need it. And you can have 1 to 6 visits. Some people only need 1 visit. They really are literally just stressed and need some resources to help with stress. So they have 1 or 2 visits with us, and they have some ideas of strategies they could use, and they're good. But other people need longer term options. And so when we figure out that this is a person that might want to stay in therapy for a while, we start working to connect them to therapy in their area of the state so that it's convenient for them.
Right.
So this is all done virtually. Okay. So people call us, people interact with us via iPhone, so that it's a telemental health link.
Right.
They use iPhones, iPads, computers, whatever. And what we've found is that people are really pretty pleased with this virtual environment. And one guy said, I didn't have to worry that somebody saw my car at the mental health clinic. And I didn't worry that while I was in the waiting room, people were judging me, because I always felt like I was being judged.
Right.
And so it's a very private way to start this conversation with someone about what's going on with you personally and how you could manage some of those situations.
Right. Well, that sounds great. How long has that program been?
We've been in business for just about 2 years.
Okay.
We were very fortunate. We're partnered with the Department of Human Services in the state, and we are grant funded. We are hoping to continue it. Our grant funding will continue until early 23.
Okay.
And we're working hard to get more grant funding and to see if there's a sustainable model that we can continue to offer this to the state.
Right. Yeah. No, Arkansas PBS knows that chasing those grants year in and year out.
Yeah.
We're used to it. No, I was COVID has been such a terrible thing that we've all dealt with for 2.5 years now. But I do think this idea of telemedicine has kind of been something we weren't doing a lot of before COVID, and then it kind of became a necessity. And yeah, one of my questions was, we have so many farmers living deep out in the Delta. They're living on 2,000, 3,000, estates, farming all this, and getting to the doctor is just an inconvenience for them.
Right.
You're talking about an hour and a half drive in and an hour and a half drive out. And so, yeah, I think that's a great program to connect people remotely.
Right. So, in some areas of the state, there's sometimes not great broadband access, but most of the time we're able to establish a link to the person. And we have an independent evaluator helping us by talking with our clients and with our clinicians to see if there's any way to improve our services. And really, the only thing they've said is that you all ask a lot of questions. And some of those are, stipulation from the grant, which, how that goes.
Yeah.
And we understand that, but we think it's a reasonable trade-off because you get mental health care for free. You get it at your convenience. We have Saturday hours for psychiatrists. We're working on extending into the evenings a little further. So we're trying to make it more convenient time-wise, but certainly people can contact us pretty much wherever they are, as long as they have some kind of. We don't like to do telephone only, so we do prefer that they be in a place where they can use the video version of their phone or iPad or tablet or computer. We also encourage people to be in a private space.
Right.
It's just better if you can establish in your bedroom or if you have a little office in your house or your work or whatever.
Right.
We encourage that. on the other hand, should they want their spouse or kids involved, we can do that too.
Right. Awesome.
So I have to give a shout out to the clinical staff of AR ConnectNow. They are absolutely wonderful. And one of the ways I got interested in farmers is one of the individuals that's a clinician pointed out to us that farmers were under a lot of stress. Right. And when I started looking at the numbers, I was very concerned and started trying to look into this in more detail.
Well, yeah, we definitely appreciate it. And, early on, one of the first things we talked about was kind of this lack of research out there, particularly local research about this problem. So, and I don't know, I have no idea about medical practices and people's personal information. Could AR ConnectNow, could that lead? I mean, could y'all take numbers from that and start building? Can that lead to that research that we kind of need?
It could help us if the farmers would call us.
Right, right.
If one of the things we are spending some time consulting with agriculture services and other organizations around the state is what would it take for farmers to talk with us? Mm-hmm. And do they feel comfortable? What would make them feel comfortable? Is it okay if somebody like me interviews them, or will they view me as, the academic? Absolutely. And they need someone, I need to get someone different. And we've been working on what it would take to talk with the farmers and get their perspective on what's going on, and also what would be an acceptable way to gather data about, say, the prevalence of depression or anxiety problems or whatever. Right. And so, and that's been where we're at, because the data are there aren't great data. Mm-hmm. And even when people have, a few years ago, there was a big kind of kerfuffle that the CDC came out with some estimates about suicide, and farmers were extremely high. And then when they re-examined their data, they had made some errors in it, and they corrected that. They were very upfront with that. But the suicide rate is still pretty high in farmers. Mm-hmm. And therefore, it needs some attention, and we're doing our best to get there.
Absolutely. And I mean, I think that's why the Arkansas Department of Agriculture has kind of, went into motion here with mm-hmm. the grant that we received, as well as I think there were 3 other organizations that received part of their grant. And so, yeah, I mean, that's why we're doing the podcast, is hopefully by talking with 6 farmers who are willing to kind of discuss these issues and get that word out and spread it across the state. Hopefully we can kind of take the stigma away from talking about these things.
Absolutely. And somebody pointed out to me recently that in PRI, I mean, the first word in our name is psychiatric, and we're very comfortable using the words depression, anxiety, mm-hmm. but we maybe should use other words like stress, or, as I said, I've known a number of people who are willing to say, COVID's driving me crazy. Mm-hmm. And if that's what you need to say to get the conversation started, go ahead. Right. Or if stress, or it's really bothering me, or, man, I can't sleep, I keep thinking about, whatever. So I encourage people to feel comfortable using their own language to mm-hmm. describe it. And don't feel like you have to call us and say, I'm depressed, or I'm anxious, or I have insomnia and can't sleep. It's okay to just call it whatever problem you're having from a mental health perspective. Mm-hmm. I encourage you to use that language, and people should just call us and talk with us. We have amazing therapists. They're very down to earth.
Yeah, that's awesome.
I'm so proud of them.
Yeah, no, some of the research I did early on was very focused on kind of meeting the patient where they are. And so one of the people out of Canada, I believe, which this conversation has been going on for a while
mm-hmm,
in Canada.
That's true.
Lots of programs in place up there. And they said that so many farmers are much more comfortable using the term behavioral health, because that's something that they've applied to livestock their entire life. They've talked about the behavioral health of horses or cows, but then when you use the term mental health, they kind of lock up.
Yeah, it's perfectly fine to use behavioral health, and I probably should use that more. Right. Sometimes it's a case of an old dog learning new tricks.
Absolutely.
But it's perfectly fine to think of it as behavioral health, and it's a good term because how you're feeling and what you're thinking really affects your behaviors, affects how you sleep, how you make decisions, how you interact with your loved ones. And so it's very important that they use the language they prefer and just, give us a call.
Absolutely.
I encourage people to use this resource.
Absolutely.
We are you don't have to be, we don't ask questions. We ask you if you're insured or not. You don't have to be a citizen.
Okay.
You just have to call us, and we'll do our best.
Awesome. Well, that's all we can ask for, especially from the super qualified people at UAMS. So.
Well, we have some amazing clinicians. I'm very excited to work with them.
Awesome. Well, thank you so much for joining us today, and we'll see you soon.
All right, my pleasure.
If you enjoyed this video, be sure to like, share, and subscribe. Visit arpbs.org for more stories and content like this from Arkansas PBS.